People ask about cholesterol content. People ask about seed oil content. And people ask about saturated fat. Where does the balance fall for those three things for most people? One pretty common question is, well, what should I avoid or what should I include in the diet? And what should I include in moderation? What should I include in small amounts? People ask about cholesterol content. People ask about seed oil content. And people ask about saturated fat. Where does the balance fall for those three things for most people?
So what should people do? There's many different approaches here. Basically, the question I ask is, how proactive do you want to be when it comes to cardiovascular prevention? Is somebody at a 1 out of 10, they want to be very natural, they don't want to make a lot of dietary changes, they're really not concerned about cardiovascular disease at that risk level? Most of our patients don't fall over there. Most people say they want to be somewhere moderate, 5 or 6 out of 10, or they want to be like 10 out of 10 preventive. And then the question is, okay, do you want to make moderate diet changes, extreme diet changes? Are you open to medication, supplementation? Most people say that they're very open to diet changes, but it's very hard to maintain a rigid pattern of eating, especially with probably like we said before, the most heart-healthy diet is going to be probably a low-fat, plant-based diet. Mm-hmm. And to me, it doesn't seem the most palatable. That's not the diet that I abide by. So perhaps someone who's not willing to do that in combination with medications, maybe they're at a 9 out of 10. Mm-hmm. Like, yeah, I'll take a medication and lower my atherogenic potential. Mm-hmm. So they're not truly 10 out of 10 unless they're also saying, I'm going to eat the heart-healthy diet too. Mm-hmm. But at the end of the day, is that going to translate to 5 more years of a health span? I don't think so.
By the way, definition of atherogenic particle would be your non-HDL and your LDL, because both of those can contain apolipoprotein B or ApoB. Just an aside.
Yeah, and we followed like a number of things. Like one of the very first things we tell our patients when they enter our practice is, hey, we think that blood pressure and endothelial health are very important. So what does your blood pressure typically run? Do you have a home blood pressure cuff? If not, go get one. Because that's a huge factor in many people. This will sneak up on them. Other things we look at, the genetic lipoprotein A. Mm-hmm. This is something I found interesting with the bempedoic acid. Even though it decreased events, which is the outcome we want, it does have the side effect of raising uric acid, which is interesting because uric acid is also correlated with an increase in events, but obviously it's a smaller risk factor. If someone's like, oh, I want to address my uric acid, but they don't want to address their LDL of 180, we kind of need to realign priorities.
So we should read a book, Spike Your Acid.